Hi, I'm Lisa Prather, and welcome to The Voice of Health with our host, Dr. Robert Prather of the Prather Practice, where lives are changed every day through the natural approach to healthcare.
Well, we're going to talk about breast cancer. It's Breast Cancer Awareness Month. And Dr. Prather, how common is breast cancer?
Well, breast cancer is the most common cancer in women. There's 245,000 new diagnoses a year of breast cancer.
Wow.
Which is huge. And 2,200 in men.
Oh, is that increasing in men?
The percentage of breast cancer has actually gone down per percentage, but it's increasing because the population's increasing. But it's actually much more deadly in men than in women on percentage-wise. So it is something that not only women should be concerned about, but men should also.
Interesting. Well, what is the death rate of breast cancer?
There are 41,000 women who die from breast cancer a year, and 460 men. So for men, it's a much higher percentage of the ones who do get breast cancer, that it's deadly.
So what are the risk factors for breast cancer?
Well, one of the things, of course, the older you get, the more likely you are to get breast cancer. It's rare below the age of 40, but it is something that occurs, and when it does occur in women younger than 40, then it's usually a genetic component. You can get genetic tests to see if you are at a high incidence for breast cancer, so that is one thing that people should be aware of. Also, your reproductive history. If you have a child after 30, your first child, has a higher chance along those lines. If you've never had a child at all, you have an increased chance of having breast cancer. One of the things that really helps to reduce the risk of breast cancer is breastfeeding. So if you breastfeed your children, it really cuts down on the chances of having breast cancer. Also, when you start your first period, if you're younger, then that can give a better chance of having breast cancer. Also, if you have a longer time that you don't go into menopause, then that increases your chances for breast cancer.
Or increases or decreases?
Increases.
Okay.
Dense breasts. If you already have fibrocystic breasts, then that's a chance of having breast cancer. One of the things you want to do is keep lumps and bumps and pains and everything like that out of the breasts as you're going along in your life. That cuts down on the risk of breast cancer. So checking yourself if you have soft, pliable breasts that there isn't really a whole lot of problem with, then your chances of having breast cancer reduce quite dramatically. So watching that and making sure that that stays like that is very important. Also, nutrition has a big effect. Obesity, if you exercise quite a bit, if you're an athlete, cuts down the chance of having breast cancer. Any type of radiation on the chest really increases the chance of breast cancer. Also, exposures to pesticides, herbicides, other different types of toxins, heavy metal toxicity, low vitamin D, low exposure to the sunshine. If you get a lot more sun, that increases your ability to keep from getting breast cancer. A weakened immune system has a lot to do with it. If you have other different types of autoimmune diseases, that increases your chances. Some of the drugs you take also has a chance. If you were taking some drugs to prevent miscarriage from the 1940s to 1971, increases quite dramatically your chances for breast cancer. Drinking alcohol, smoking, all those different types of things also increase your chances of getting breast cancer.
Interesting. So, you talked about, a lowered immune system, and we have a patient that's going to be sharing her story today. But she talked about parasitical infection.
Yes, that is also any type of a toxin along those lines. Low vitamin A, low vitamin D, and low iodine. If you have quite a bit of that in your life, then that increases your chances of getting breast cancer.
Interesting. Can breast cancer be prevented?
Yes. If you're looking at all cancers for prevention, 60% of all cancers can be prevented nutritionally.
60% can be
60%
prevented nutritionally.
Yes.
Interesting.
And really, when you're talking about breast cancer, the genetic component on that is really about 15%, which is an unavoidable type of thing. So that's a real important type of aspect. Most breast cancer can be avoided through lifestyle type changes. So it is something that can really be worked on and made sure that you don't get it.
Mm-hmm. How is breast cancer treated?
One of the more effective ways is, of course, surgery. Either a lumpectomy or a mastectomy is one of the ways that is the most effective. Next most effective way is hormones. If you can control your hormonal level, and having a dominant estrogen instead of a balanced hormones can really kick up cancer quite a bit. So your hormonal balance is very important. So one of the things, not only do they do a lumpectomy or a mastectomy, but they can also do a hysterectomy as something to help to control the hormones is something that's done quite a bit.
And what hormone did you say?
High estrogen.
High estrogen.
So if there's an imbalance and you have toxic levels of estrogen, then that can be a big factor. And of course, once you put on extra weight, then your estrogen level raises up. So how your hormones do throughout your life is a very important aspect for breast cancer. Chemo and radiation, of course, are other different types of treatments for breast cancer. So those are all things that you look at as a set of treatments.
Okay. Well, what role does structure function care play in breast cancer? We at the Prather practice, we do structure function care.
Well, structure function care, one of the things that the Center of Disease Control talks about with breast cancer, there's many different types of ways to approach it, and they give you three. One, where people go for the surgery and they go for the whole medical route as a route that is the only one that they do, which is a common way of doing it. There's also a choice where people don't do anything. They just do palliative type of care. You can also do a choice of care where you're watching it and just doing structure function care, which is considered more of an alternative means of doing it, where you're trying to do it naturally. Or you can come in where you're combining the two. Where you're doing the medical treatment and doing structure function care, where you're working with the structure and the function of the body to get the optimal type of results. Each of those are legitimate and different ways of doing it, and people do have a choice on which one that they want to do. We at Prather Practice support people. We don't try to influence them on which way they go. We do try to monitor it and make sure that whichever direction that they're doing, that they're making progress. So lab tests are extremely important. There are markers for breast cancer that you can follow, which are extremely accurate. And as we are doing those, we can see if the course of treatment that you're actually doing is working for you, which we always insist that people have consults with an oncologist, make sure that they have a full choice along the lines of what they're doing, and then also give them a real good picture of what we're doing with structure function care. Because I feel that definitely it makes a big difference if you're as healthy as you possibly can while you're going through whatever choice you make on your breast cancer.
That immune system is
very, very critical.
Yeah.
There's toxicity. How well your liver's working. Are you detoxing? Do you have your nutrients all up to par? All those things make a very, very big difference in your outcome with the breast cancer.
When we come back, more on Breast Cancer Awareness Month.
You can win a free 60-minute massage in a relaxing spa at the Prather Practice. Each month, we have a drawing to give away a free massage to one of our lucky Facebook and Twitter fans. Follow us on Facebook and Twitter on our website at thevoiceofhealthradio.com. This is The Voice of Health with Dr. Robert Prather. The Voice of Health Wellness Tip with Dr. Robert Prather of the Prather Practice. Dr. Prather, you talk a lot about structure function care and disease care. What is the difference between the two?
When you're talking about disease care, you're usually talking about an interference in the body's normal mechanisms. There is a time for that. When the body is actually in a process of free fall, is a good way to kind of put it, where the body is no longer making sense of what it's doing. And we're on a pattern that it will actually crash, then you need some interference. And the best way to actually do that is through pharmaceuticals. Pharmaceuticals are classified as poisons. They actually take the body further away from homeostasis, which I'll define here in a second. But at those times, that is actually necessary. So when the body is in a crisis and is no longer able to heal itself, that's when disease care is actually critical. That's where you actually utilize the pharmaceuticals and the surgical methods. What we're usually involved with is in structure function, and as opposed to a disease care, it's health care. Everything that you use in a structure function standpoint is something to bring the body back into homeostasis, which is balance.
Okay.
Dr. Guyton talked about homeostasis as the definition of health. If the body can maintain homeostasis, where it's in a perfect balance with all the different types of things that are coming in that are interfering with its function, that is the perfect state of health. And that's based on a balance of the physiology, functional, and upon the structure portion of the structure function.
Well, you talk about the body as the hero. What do you mean by that?
Body has a self-healing mechanism to it that can just make all sorts of corrections if we can just get out of its way. The whole idea behind healthcare is to provide the impetus, the needs, and the basis of what it will take to actually get the body well. So finding out where it's off, doing the proper diagnostics, and then making the proper type of adjustments into the care will actually result in the healing and the position that the body should actually be in.
Well, find out how structure function care can impact your life. Schedule your appointment at the Prather Practice, 317-848-8048. That's 317-848-8048. Or learn more on our website at thevoiceofhealthradio.com. The Prather Practice, restoring hope. You're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, the most comprehensive wellness center in the Midwest.
Well, we're talking today about Breast Cancer Awareness Month. And Dr. Prather, at the Prather Practice, where you practice structure function care, and if a radio listener's been listening, we talk about what structure function care is. But do you treat patients with breast cancer?
We do. That is a very common thing that people come into us with to provide the best quality of care that they possibly can. So that's a very common type of a diagnosis that we get in our office.
Mm-hmm. And I know you talked about making sure your patients, if you're treating them, have an oncologist.
Yes. One of the things that we always insist is that they get a full picture and that they continue with an oncologist as we're seeing them. Mm-hmm. Because we want the patient to have a very well-informed view of what's going on so that they can get all the care that they possibly need.
What areas of care do you provide with breast cancer?
We look at the whole person. That's one of the things that all the patients really say, is that, you're looking at every different aspect of our care. There's several things that go into any type of a cancer that need to be addressed. Oxygenation is very, very critical. Oxygen kills cancer cells. The only ways that you can develop cancer is if you have a lowered oxygenation to the cells, which is one thing that occurs. You also have to have a weakened immune system. You have to have some toxins that are kicking it off. So detoxification is extremely important. A weakened immune system has to have occurred. You have to have the genetic changes that happen. And you also have to have a pH shift. All those different types of things that we need to look at in a situation for the care of the patient. Weight loss is an important thing. If they have too high of a fat percentage, what type of exercise, what are their nutritional needs. All those different types of things go in. So we really look at the person top to bottom and make sure that they get all the factors that are necessary to shift the body away from more of a cancer state to more of a healthy state.
Well, you were talking about some of the preventable things. You talked about diet. So what role does diet play in breast cancer?
Diet is huge. One thing that is very true is that high fiber. A high fiber diet really cuts down the incidence of especially colon and breast cancer. So there's a real strong correlation on that,
We've
which
talked
people
about
don't.
that.
Yeah, people don't even think about it. And we've had whole talks on just all that's involved with fiber. And we do a stool kit where we can determine what is the level of fiber that you're taking in. So fiber is very well established that it prevents cancer. We haven't shown that it, that it helps with cancer, but it's certainly something that we raise up quite a bit. Shifting the diet more to a vegetarian diet is something that works quite well, cutting down on animal fats while increasing your omega-3s, omega-6s, and omega-9s. So more of the vegetable fats is very important. How you cook, cutting down on food allergies. We have a very excellent food sensitivity test. It's about 97% accurate. So shifting their entire diet is extremely, extremely important.
Getting that inflammation down.
And getting the inflammation down plays a very, very huge role in treating someone with any type of cancer, especially breast cancer. Breast cancer is very sensitive to diet.
Can herbals be helpful with breast cancer?
Herbals are extremely helpful. One as a preventative, and then also to boost the, especially the immune system, while people are going through trying to help their bodies get rid of the cancer. So there's several different ones. Aloe vera is extremely well known to be anti-cancerous. Laetrile, of course, B17, is something that's in there that has been shown to be very effective against cancer cells. So that was
B17.
B17, if you remember that,
Yes.
when we went through the whole Bs.
No, I don't remember.
All the things. You don't. But we did a whole thing on that. Yeah, there was a lot of Bs. Berberine, it's found in golden seal, barberry root, and Oregon grapefruit. So those are herbs that are very, very helpful. Bromelain, carnivora, found in Venus flytrap. So we use Venus flytrap as a anti-cancer. It's also a very strong immune booster. Chlorella from freshwater algae, very helpful. Coumarin, we find coumarin in dong quai. You've taken that before. Sweet clover, red clover, and those are some of the things that are found very commonly in something called the Hoxie formula. That was a herbal formula that was put together and was used as a cancer treatment in the United States. Very famous.
And what's it called?
The Hoxie formula. And different forms of the coumarin in there has been something that's shown that's very effective, especially against breast cancer. Curcumin and turmeric, echinacea. Echinacea is very good for draining out the lymphatic tissue. And basically, one of the big things that is very important is how well is the lymph system flowing in breasts to prevent and to help work with breast cancer. Garlics and onion, very good for cancer. Also, green tea is something that is well known. Pardiarco, we use that quite a bit. Mistletoe, yes, actually mistletoe that you stand under, is something that we use in our office. Panax ginseng, and then Ojibwa tea. We like the Ojibwa formula. It's something that Hiawatha actually was supposedly had come up with and given to the Ojibwa tribe, and they found that that was traded throughout North and South America. There was a condensed formula of the Ojibwa, which was called Essiac tea, and there were about 40 Essiac cancer clinics throughout the United States at one point, where they would use that to treat it. But the Ojibwa formula is a lot more complicated than the simplified Essiac, and we find that that's actually more effective. And then shiitake mushrooms also are some of the herbs that are used against cancer. So there's actually more, but I figure that that's a pretty good amount along those lines.
What's nice, we can test specifically
Which ones are going to work, yes.
What place does vitamins and minerals play?
Very, very huge portion along those lines. One of the important things is when you look at vitamin D. Vitamin D probably is the vitamin that has the biggest effect on breast cancer. The levels on that are very, very helpful to prevent breast cancer. And then also, once you have breast cancer, it's important to make sure that your vitamin D levels remain at a healthy level. Now, you can also go too high with vitamin D, so you need to be careful along those lines. That's why blood tests are very important and extremely accurate. So that would be one thing. Vitamin A is also very well known to, one, prevent cancer, and then be very important during a cancer treatment. Both of those are extremely important, and folic acid is probably the most important vitamin on preventing breast cancer. Folic acid is the most common vitamin deficiency. B6, B12 all play a very, very big role also in cancer. Vitamin C, getting too low on your levels on vitamin C is a big problem. Low iron can also be a big problem, but also too high of iron can kick off cancer.
It's all about homeostasis, isn't it?
It's all about homeostasis and balance in the system. Vitamin E, one of the things is fibrocystic disease, when you have too dense of breasts or painful breasts. Vitamin E and iodine are two of the things that really take that down quite amazingly. And also both of those are very, very important for keeping at a good level with breast cancer. So looking at those, vitamin K also plays a very important role. Copper, going too high or too low. Again, it's a homeostasis along with the balance of zinc. Both of those plays a very big part in, one, treating breast cancer, and then also keeping breast cancer at bay. Germanium, magnesium, all play a very, very big role in treating breast cancer, making sure that those levels are all at an optimum.
Yeah, very important. So when we come back, more on Breast Cancer Awareness Month.
Listen to the Voice of Health Radio on your smartphone or tablet on all of the top radio apps available. TuneIn Radio, Stitcher, and iHeartRadio. You can find these apps and more on our website at thevoiceofhealthradio.com. This is The Voice of Health with Dr. Robert Prather. Laughter is the best medicine.
You know it's bad when Taco Bell has a health food menu. I don't know if you all seen this commercial, but there's a commercial where a woman willingly gets on television and says, "I've lost 25 pounds on the Taco Bell drive-thru diet." That's called diarrhea. See a doctor.
The Voice of Health Minute with Dr. Robert Prather of the Prather Practice.
Deficiency in iron, the most common people that are going to have a problem along those lines, number one, are pregnant and lactating women. That is something that is not checked at this point, but should be checked.
I didn't realize that.
When you were pregnant, I made sure your iron levels were up to par. I gave you supplements and gave you a diet that was very heavy in the red meat department.
Lots of
And
protein.
you had to eat a certain amount. We actually weighed it out every day. And
I felt great.
when you actually went through your pregnancy and afterwards, they said, wow, this is what a pregnancy should look like. This is what a delivery should look like. That's what a placenta should look like. And those were all healthy babies. So I made sure that you were well taken care of.
It was a great experience for me.
Yes, and it should be. A lot of the problems that are actually going on are nutritional deficiencies.
Schedule your appointment at the Prather Practice, 317-848-8048. The Prather Practice, restoring hope.
I was feeling so bad. I asked my family doctor just what I had. I said, doctor.
I'm Lisa Prather, and you're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, where we get to the root cause of your health issue.
We're talking today about Breast Cancer Awareness Month. Dr. Prather, let's talk about free radicals. Why is free radical pathology so important in breast cancer?
Well, free radicals are probably one of the most important ways of, one, if you can keep your free radical pathology down, very, very important for preventing cancer. And then if you get cancer, keeping that down is very important to be able to get over it. Because it's the free radicals that get released while we're having our oxidative process, where we're making energy in our cells. Those free electrons go around and cause damage to the tissue and also to the cells. So a lot of the genetic mutations that occur that kick off cancer come from free radical pathology. The higher you have of the free radicals, also the more dense your breasts become and the more tender they become. So really cutting down on those free radicals is extremely important. That's why vitamin E plays such a big role in helping with fibrocystic breast disease and also cuts down on the free radicals during cancer. One of the problems that occur when you're getting treated for cancer, the chemo and the radiation is very good for killing cancer cells, but it increases the free radical pathology in the body, which starts to cause more damage and can perpetuate or kick off new cancer. So keeping that and then getting that under control is very, very important, especially after you get over the cancer with the chemo and the radiation. Oftentimes it can kick up just because of the treatments that are involved in it that increase the free radical pathology. So free radicals are basically what feed cancer. So getting that down, vitamin E is a great way of doing it. Vitamin A, vitamin C are all antioxidants. And keeping up your antioxidants to prevent breast cancer during the time that you're being treated for breast cancer and then afterwards, making sure that those go down to a proper level is extremely important. And we can do different types of tests to determine what is the level of free radical pathology going on in your system.
So you can know. Yeah.
We can actually know. So we're not guessing whether you have free radical pathology. We know through the different types of tests. And then we can do the treatments and we see a definite decrease on that. Everything's based on lab tests. So again, we're not guessing. We know as we're doing the treatments whether we're making the improvement.
So how can acupuncture and chiropractic help with breast cancer patients?
That's a very interesting area and something that is recommended. Studies on anyone who's going through any different types of cancer treatments, they find that if they get chiropractic and acupuncture, that there's an 80% decrease in adverse symptoms.
Wow.
So fatigue, neuropathy, even the hair loss, all the different types of things that people complain about, there's 80% less complaints. Now, they didn't find a difference in the longevity or the death rate. What they found is that people were extremely more comfortable and had less problems after the whole cancer treatment. So there was less neuropathy, there was less brain fog. So very important for the symptomatology and something that everybody should be looking at.
How about homeopathy?
Now, homeopathy we consider our biggest effect on any type of a treatment in the body. Homeopathy, when we can get that and figure out exactly what homeopathics are needed, and there are 3,000 different homeopathics that are considered classical, and there's another 20,000 that have been added to the whole repertoire. So there's a tremendous amount of effects on homeopathy, and homeopathy is one of the things that we can make the quickest and the most dramatic changes in the body and how it works. The big thing that people have against homeopathy is they don't understand why it works. Homeopathy is basically based on vibrational energy. So it's based on quantum physics. And the truth of the matter is that we are not really solid matter. We are a vibration. And so homeopathy gets to the root of the problems and then finds out what type of a vibrational change needs to be made in your body and changes the whole constitution of what's going on. The reason that homeopathy may not work on people is you have to find exactly which one is going to work the best. And that's where we really have the upper hand, because we can actually test and go through all the different types of 25,000 different homeopathics and find out which one's going to work the best
That
for
just
you.
sounds like a long appointment. But
I tell people I just went through 3,000 different homeopathics on you in less than a minute, and they go, "Really?" And I say, yes. We find out for you, the homeopathic that works really great for you, Lisa, is sepia. And that has a big effect, and we can see some immediate types of changes. Sometimes we can hit the right homeopathic, and then when we do a breast exam immediately afterwards, after taking it, there's a difference in the density of the breast, which even the patient can feel the difference.
Right.
So they're like, wow, that is making a huge difference already. The other things really take a little bit more time to work, but homeopathy works just like that.
I love homeopathy.
Yeah.
Love my sepia.
Yeah.
Well, let's talk about underwire bras.
One of the things that is very, very critical is the lymphatic system when you're talking about breast cancer. Basically, how well your lymph system is doing is how well the breasts are going to be doing. And so anything that causes problems with the lymphatic system is a problem for the breasts. It's a circulatory system. If you have underwire bras, that can cut off breast lymphatic circulation. Breasts were designed to move. They're supposed to be pumping the lymph system. And if you restrict the motion of the breast, you're going to cut out the lymphatic flow. That's one of the reasons that echinacea or any type of other different types of herbals that help with lymph flow is very important for the breast.
It was a Mr. Brazier that, right?
Yeah, Brazier. Actually, he stole it.
Okay.
And really, his name really was Titzling.
But it was a male, right?
It was a male, right.
What screenings are important for breast cancer?
Of course, having the imaging. Now, there are several different types of imaging. One, of course, is the mammogram. Now, there are controversy with the mammogram because there was a study that came out that said mammograms can increase the risk for breast cancer. And that's basically from the radiation. Radiation, of course, is bad, and it's a soft tissue radiation, so that's an issue, and then also the pressure on there. But there are other means of also examining the breast. There is ultrasound, MRI, and also thermography. But having imaging on the breast is very important. Also having the genetic tests, and then also measuring, all the other different types of factors. Are you anemic? Is your liver toxic? And then also having the physical exam, because dense breasts, tender breasts are always a sign. And then also looking for lumps or other different types of changes in the breast are very, very important to make sure that you are up on that and can pick up anything that might be going on at an early stage. The earlier you can get something, the better. And then also genetic testing.
And then self-examination.
Self-examination and physician examination is important.
Right. Well, why should someone with breast cancer seek out a structure function doctor along with medical care? And we just have a few seconds.
All right. It's very important that you're as healthy as you possibly can. Even just one thing, being anemic can increase your chances of having a bad outcome for breast cancer by 50%.
Okay.
That's just one factor.
Thank you, Dr. Prather. Up next, we're going to be hearing from Joy and her journey with breast cancer at the Prather practice.
Never miss an episode of The Voice of Health so that you can stay informed and empowered about your health. Get a podcast of our show automatically delivered to you every week by signing up for our show on iTunes. You can find that link on our website at thevoiceofhealthradio.com. And don't forget, thevoiceofhealthradio.com has complete archives of all of our past episodes with an audio library of information to help you add more life to your years and more years to your life. This is The Voice of Health with Dr. Robert Prather.
I'm walking on sunshine. I'm walking on sunshine. I'm walking on sunshine.
You're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, where our mission is restoring hope to our patients.
Well, for our Restoring Hope segment today, we are joined by Tommy and Joy to share Joy's story. Joy, how did you come to the Prather practice?
I have been sick with a blood parasite for over 25 years.
25 years.
And have been from doctor to doctor to doctor. I had been out of the country in Peru, South America, and contracted this parasite. And came back into the country, and I did find a tropical disease specialist who was able to name it. He knew what it was, but he retired very shortly into my seeing him. So that led us to go on this long journey of trying to find a doctor who knew about this parasite. And we literally went to 49 doctors. 49 and natural doctors as well as allopathic or conventional doctors, and none of them really even knew what this was, much less did they really even understand about parasites or even how to treat them. And it continued to weaken my immune system to the point that I believe that's how I got the cancer, because my immune system had gotten that weak that I got the breast cancer diagnosis in 2016. And we have a local chiropractor back home. And of course, at home is Macomb, Mississippi. Yes. Yes, 900 miles away. He told me one day, he said, I know a doctor who I know can help you. He told me about Dr. Prather. And I immediately went home and I called for a free consultation and had a free consultation with Dr. Prather. And immediately he started explaining to me about parasites and how to kill them and get rid of them. And I told him about the cancer as well. But I was more excited that he knew about the parasites than because I knew that it had to have been one of the main root causes for the cancer. Got off the phone with him and I was so excited. And Tommy came home from work and we talked about it. And God just sent us a verse in Isaiah that says, whether you look to the left or the right, you'll hear a voice behind you saying, this is the way, walk in it. And when we heard that voice, knew immediately we had the peace that this was where God wanted us to come. And we really didn't know how all this was going to work, but God did. And God had already gone before us and prepared the way, and here we are.
And when you say, how God's worked it out, even because you stay an extended time when you're here, it could be a week at a time, and He's provided house sitting for you and new friends
Right, that's right. It's amazing how he worked that through friends that we had at home, and just happened to know people here in Indianapolis that he's provided homes for us to stay in. Because of the weakened state that my body was already in, because of the parasite, when I was first diagnosed and went to the oncologist and the 3 doctors that I was seeing at first, I told them that I could not do chemo, radiation, or surgery. I was actually not opposed to the surgery until he told me he could not do the double mastectomy without first doing 9 rounds of chemo and then more chemo and radiation after the surgery. And he knew my history, and I said, if I do that, then that is going to kill what little bit of immune system I still have, and I will have nothing to fight with. He said, I understand. He said, but this is the only protocol that I can offer to you. I wasn't able to go that route, and I'm grateful because I honestly don't think I would be here because my body would not have been able to withstand that harsh of treatment with the little bit of immune system that I did have left to fight with. And I truly, truly believe, and Dr. Prather has helped me to understand this even more so, is how important the immune system is, and it is what God created in our bodies to fight disease with and to fight sickness with. So it just makes sense when Dr. Prather explains to me that you build the immune system up, you build your body up, and then your body can fight the cancer on its own. And that is exactly what's happened.
That's exciting. Thank you for sharing that. All of our patients receive thorough diagnostics when they come. What did those initial tests, like the Prather profile blood work, reveal about your health?
The main thing that it showed was how unhealthy my body was, how unhealthy the organs were, my pancreas, my kidneys, my thyroid, my liver, my adrenal glands, my spleen. All of those things were very unhealthy.
Well, can you tell us a little bit about your first visit at the Prather practice?
I wanted to just mention this because it's such a difference. When they referred me to the doctors back home, when I first got my diagnosis, I had to meet with several doctors, and the oncologist was one of them. And I just will never forget going into the waiting room there in that hospital setting. And it was dark and it was drab and nobody was smiling. It even had an unpleasant smell. And I just felt so bad for all of those people sitting there. And then went to talk to the doctor, and the only thing that she offered me was the same thing, that the same protocol. And then on top of that, she wanted me to take a certain drug that had very much of a side effect of putting me at risk to get another cancer, a different type cancer, on top of the breast cancer that I already had. I could not understand that. I couldn't understand going that route. But in talking to Dr. Prather on the phone, and then when I got here, I remember walking into the lobby, the waiting room. People were smiling. People were laughing. There's just a pleasant atmosphere. There was just a pleasant feel. All the girls up in the front desk just greeted us and were so friendly and just smiled, and I just felt hope when I walked in the door. And then when I went to talk to Dr. Prather for the first time, I just remember him just patting me on the shoulder and saying, "It's going to be okay." And you can't imagine what that felt like, to hear that hope in him when all I had seen was doctors who I felt were more fearful than I was. And so to hear him say it's going to be okay, and to know the confidence and the hope that I saw that he had, it restored that hope really in my heart that I needed. And it's just been that way ever since. It just gotten better and better, just more hopeful, and it has been great. So when he first did the diagnostics in that first visit, we had done all the scans that they had asked us to do, the PET scans, the MRI, the sonograms, the mammograms, even the biopsies and all of that they asked us to do, and had not had real good experiences and not real definite answers really, other than from the biopsy they found I had stage 2 breast cancer is where it was at first. It was probably around stage 3 or 4 by the time I got to Dr. Prather. But even with the MRI, they sent us the results of another patient's test results. And so we just had experiences one after another like that. And the radiologists, when they found out I had gone to Mexico, they were so discouraging, and they told me, "Don't you realize you're going to die from breast cancer if you don't do this protocol? You need to just quit doing what you're doing and put all that natural stuff away and just follow this protocol, because you're going to die if you don't." And I heard that from one doctor after another. When I got here and Dr. Prather did his diagnostics, and he began to find real answers, and he found that so many organs in my body were unhealthy. And not only that, he found that I had not just one parasite, but I had like 26 different parasites in my body. What he did in one blood test and one stool test found more answers than any of all of those other scans did put together.
Went to the root of
right. So, and then from there he could start going to the root cause of what was actually causing my weakened immune system, which was causing the cancer, and go and start going after the root causes, which is what he has done, and it's built up my body and built up my immune system to the point that when I came here, my cancer markers were in the 80s, and now they're in the 20s.
That's wonderful. That's
so
wonderful.
It just didn't, and he told us it was going to be 2 years, and almost to the day. It's been 2 years, and we're just about where he wanted me to be.
That's wonderful. So let's talk about the various services you received here at the Prather practice. I know you got lymphatic massage as a treatment. You've been doing the supplementation with the EDS and acupuncture and chiropractic. Let's just talk about those services and how they've helped you.
Okay. First of all, the homeopathics have been amazing. The homeopathic injections and the supplements that I take there. When my original tropical disease doctor had told me that I would never be rid of this parasite, that it would lie dormant, it would be active, that I would never be rid of it though. And I get to Dr. Prather and he says, "Oh no." we have something that's going to kill it. It's going to obliterate it, and it's going to be gone. And that's exactly what he did. And it took about 6 months of the homeopathics and treating the parasite to where he had killed the adult stage, the larva stage, and the egg stage. And it was gone out of my body for the first time in 25 years, that it had been there that long, and now it was gone. So he did some specific lymphatic chiropractic adjustments, basically his spinal fluid was totally blocked in my body. And so he did this, what seemed like a simple adjustment. It was very gentle, it was very easy, but in that one little adjustment, it completely opened up that
Cerebral spinal fluid.
Yes, cerebral spinal fluid, that's right. Again, so it can flow like it's supposed to. And that was one of my biggest problems, is my blocked and stagnant lymphatic system, the lymph flow, and not being able to eliminate like I'm supposed to, like my body is supposed to be able to eliminate cellular waste. And then he also found that the ileocecal valve, which is that valve in between the large intestine and small intestine, it has this little flap on it, and the flap was staying shut. And because it wasn't opening and closing like it was supposed to, it was causing all kinds of inflammation. And so he had a very special adjustment for that he did. And I remember the first time he did it, I reached up and grabbed his arm. I was like, whoa! Wow! Did that open it up? And he's like, yep. That did it. So it's just amazing what he can do, and his knowledge of the body, and how he knows it all works together, and what needs to be done in order to clean up the body in there to get it functioning to its optimal health and to get that lymph flowing like it should. And he has a special program on that, by the way, on the radio show, that if anybody needs information on, which he's got all kind of different topics that he talks on, but that one was very helpful, so helpful to me, to help me to understand the lymphatic system and how important that is to my healing.
So what results have you seen so far as a patient at the Prather practice?
I can say that Dr. Prather has absolutely saved my life. Don't think I would be here had it not been for his knowledge and his wisdom and all that he has done to find the things in my body that needed to be healed and cleaned up, and in order to build my immune system back up, which has allowed me to be here with my family.
Yes.
And to still homeschool my boys. I just think about throughout the whole 2 years that we've been coming, even though the trips have been very hard, driving 12 hours at a time, and at first we were coming once a month, staying for a week at a time. We have gotten exhausted and weary during those trips, but I haven't had to miss one soccer game or a graduation of our older son from high school, or any of their events or special things that we do as a family, or just being there for my family, to be able to take care of them and to be able to continue to homeschool and to be able to just take care of the things at home. I have been able to continue to do all of that.
Was it last time too you both went zip lining at Eagle Creek?
We did.
We did a family fun day.
We did.
We took the staff after that.
That was fun.
Yeah,
Very
it's
challenging. It was. But just to have the strength to be able to do that was huge. Just continuing for Dr. Prather to build my body up instead of having it to be broken down and the immune system to be suppressed. He has built it back up. Just every visit giving me more energy and more energy.
And you can see that from the first time you came in to now.
I sat down and wrote a list of my symptoms before I came, to look back and to be able to see the difference in myself now. There's probably 30 symptoms on here. Anything from severe fatigue, brain fog, lower back pain, hair falling out, night sweats, chemical sensitivity. I had cysts in different places in my body, couldn't sleep, extreme nervousness, severe constipation, nauseated, very cold all the time, being off balance, anxious, feeling unstable, and I could just go on and on. I mean, it's just, and there's even so much more on here that I was experiencing, and all of these things are getting better. I was having migraines, swelling in my stomach, legs, and feet, and I can say that all of these things are getting better.
That's exciting. So one of the amazing things about your story is the number of people who you have brought along with you to the Prather practice, because you've been so excited to share your experience here. I mean, how many people have you brought here?
Well, we were counting last night. I think it's around 20.
20 and counting. Wow.
But we're just so grateful that we have a doctor and a place to tell them about now, because a lot of our friends were sick like us, and now we have that hope to go back and tell them, hey, we know where you can go now. We know a doctor that you can go to that's going to be able to get to the root cause of your sickness and help you get well.
It's wonderful.
And so it's wonderful for us to be able to see them come in and to go back home and to see that health and wellness that they're receiving as well, and to see them getting better.
That's exciting. I want to make sure before we end that you share anything else, or if Tommy, if there's something you want to share.
I wanted to tell a story about my endocrinologist. Back home, he's been my endocrinologist for about 15 years. So when I told him about where I was coming and what I was going to be doing, he said, I just wish you the best. And he said, and I want you to do this for me. He said, if you get there and your thyroid gets better, you come back and you tell me about it. And he said, and I'm going to apologize to you because I feel like maybe I haven't been doing everything that could be done. And so I did. After 2 years, they actually contacted me. This was about a month ago, and said, if you don't come back in, we can't keep you as a patient. And he could see how well I was doing, and he was really glad about that. So I gave him the Prather profile from Dr. Prather so he could see all the blood work. And he looked at it and he said, wow. So I'm not sure what you want me to do. He said, it looks like you are doing great, and like you are getting everything you need, and things are going in the right direction, and you just keep doing what you're doing. So I thought that was good.
Well, thank you, Joy. Thank you and Tommy too. You're here for support. A wonderful husband. Takes good care of you, doesn't he?
Oh, yes. Oh, yes. I could not. That's another thing. I couldn't be here if it wasn't for him. He has been my stronghold. Story in the Bible of Moses where Aaron and the other men were holding up his hands when he couldn't stand any longer, and that's what Tommy has done. He's held up my hands through this, and he's just been my biggest support, and he has worked hard back home to provide for us to be able to make the trips, and I can't say what a big enough blessing he is in my life.
Well, you guys have become like family.
There's times I've had to go home when she's had to stay, and it's hard when you see your wife going through these things, but when you have a staff like the Prather practice has, and you have the love that they have here for their patients, as well as the professionals that they are, it makes it a lot easier to go home and to leave her here in these hands that I know that she is way beyond taken care of. I've never seen it in any place like this. Like I said, we've been to 49 other doctors and many facilities, but I've never seen the care and the commitment that I see at the Prather practice and the way they take care of their patients. So y'all were such a blessing to us for all that everyone here has done for us. And y'all welcome us in, just like family when we come, and we kind of get excited when we get to come.
We get to excited when we see you guys on the schedule.
We have a good trip when we're here. We have fun, and that's the neat thing about coming here is just as Joy spoke about. If we would have went the other way of treatment, you don't have this. You don't see this much hope in there. And we pray for those people each and every day, and that's the way God's got them going. And I know there's a lot that comes through there that is good, but for us, we know this is the way that God has gone before us and provided the way. And we never would have thought 800 miles away was where we needed to be, but it is.
Thank you both. You've been truly a blessing to us,
to our patients, and we love you guys.
Love y'all too. Thank you.
The Prather practice is located at 8902 North Meridian Street on the north side of Indianapolis, just south of the I-465 loop. If we can help you to achieve better health, we'd love to hear from you. Connect with our office at 317-848-8048. That's 317-848-8048. Join us again here next week or anytime on our website at thevoiceofhealthradio.com for The Voice of Health with Dr. Robert Prather.